Welcome back to the Yin Fang Podcast, where we explore holistic health for all ages and all aspects of life. Today, we're joined by Jana Roso, a board-certified pediatric nurse practitioner with Neuro Nutrition Associates. She specializes in the biomedical treatment of autism, PANDAS, PANS, ADHD, gut health, and chronic illness in children. Jana is passionate about helping families uncover root causes and explore real, functional solutions, often far beyond what conventional medicine offers. In this episode, we discuss everything from the microbiome health and nutrition, environmental toxins, informed consent, and the idea that even complex diagnoses like autism can improve and in some cases resolve when the body is supported holistically. This is an eye-opening conversation for anyone seeking a deeper understanding of pediatric health and healing. With that, let's get into it.
All right, welcome. We're so excited to be here with Jana Roso of Neuro Nutrition Associates, also formerly at Alive and Well,
Yes.
and the author of a book about autism, which is really cool, co-author, and a practitioner that we ourselves have brought our kids to see. So we know you from all angles.
Yeah.
And you're just a beautiful, wonderful person also. So it's so fun to have you here. And I'm excited to pick your brain. I feel like the space of functional, pediatrics is something that there's just not a ton of practitioners that are focusing there. And parents have so many questions. So we're going to dive in and hit all the topics. So thanks for being here.
Thank you for having me.
Yeah. Okay, so let's just get started with kind of a backstory. Like, what drove you to get into the functional, specifically like the neuro nutrition space?
Well, it was a long road, and I feel like everyone in functional medicine would say that they had life experience with their health. And I would also say that I think God was just kind of moving me along this road that I didn't even know where I was going. And from an early age, when you fill out those little forms at school, when they're like, what do you want to be when you grow up? I had written pediatrician. So I knew that I was on a health road myself to do something in that arena, but I didn't know quite what that looked like. And I dealt with a lot of health issues as a kid. I had a lot of gut issues. My parents didn't really know what was wrong with me, but so I spent a lot of time in the doctor's office, and then a lot of my journey I learned actually as an adult, but we moved into a house with black mold when I was in middle school, and that greatly affected my health with anxiety and OCD, and I probably back then would have been diagnosed with PANS, now that we know what that is. And so just a lot of health stuff. And when I got into college, I had decided that I wanted to go into nursing. I'm like, okay, I finally know what I want to do in the health arena. And so I went to UT and I went that route, and I ended up in the alternate entry program, which is a program for people with a bachelor's. You can really have a bachelor's in anything. Yeah. And then you get in with the plan to get a master's in nursing. And so I'm in that program. I'm working at the time in children's oncology at Dell Children's. So PD oncology. And I had just the best team, wonderful work family over there. But I was realizing that everyone that was getting their master's, they were coming back to work on the floor. And I'm like, well, what are you guys doing back here? Like, I thought, there would be like a step, up above working the floor. We're like, well, there's not really a plan for having your master's in pediatric nursing. And so I'm thinking in my head, okay, what am I going to do here? Because being a floor nurse was not my life goal, even though it was very fun at the time. And I realized that they had a nurse practitioner program at UT. And so you could apply and get in on the side. And that's what I did. And that was where I met Emily.
Oh, cool.
Yes. And so we did that program together. There was a small cohort of us. There was only 4. And we went through, 2.5 years of NP school together. And then we got out and we went our separate ways. We were doing primary care. Most of us were doing primary care. And I had a baby. And then one day Emily calls me. And at that time, I'm working part-time at a private practice, at home the other days. And she says, "Hey, have you heard of functional medicine?" And I'm like, "No, what is that?" And my husband and I had been dabbling in paleo. We weren't fully immersed in any kind of functional lifestyle, but definitely on the food front. We were playing around with gluten-free, paleo. And she said, "Well, I know that you guys really enjoy eating healthy and you're really into paleo, and functional medicine is more about like cleaning up your diet and your lifestyle for the sake of your health." And she said, "Why don't you come with me to this conference? I really want to branch off and maybe open up my own practice that involves treating autism." And so that's how that journey started. And I went to this MAPS conference, the Medical Academy of Pediatric Special Needs, and just really blew my mind with everything I was learning. And so I joined Emily and we opened our practice, and we were so new and fresh, but we just hit the ground running.
Yeah. Wow. That's so interesting. So had you had your own kind of food, it sounds like you were saying you were dabbling with food. So had you already kind of made the connection? It sounds like you had a bunch of chronic stuff as a kid. So at some point you made the connection, even though you were working and it sounds like a Western model, to like food and lifestyle as kind of healing factors.
Right.
Yeah.
Yeah. So I grew up on a very standard American diet, the 80s. My parents, they did what they knew was best.
Yeah.
But a lot of gluten and a lot of dairy, that was probably most of my diet. And I had a lot of stomach issues. And so when I met my husband, he was very much into Dave Asprey and paleo. And he's like, "I really feel like you would benefit from changing your diet." And at the time, I'm like, "What? Why would, why does that matter?" And this was before we had kids. And he's like, "Let me just cook this way and you can eat it and let's see how you feel." And it really was the first step in me changing how I felt, and all of my gastrointestinal symptoms went away. And then when I got into the functional space, I started doing more testing on myself and confirming a lot of what I had found to be true when I removed things from my diet. Oh, I really do have a sensitivity to every type of dairy, and I shouldn't be eating gluten. And so, yeah, it was very pivotal to my healing.
Yeah. It was the reverse of us. Like, your husband started cooking for you, and like kind of opening, sounds like kind of opening you're already like super health focused and treating people, but then incorporating now, like, as you felt maybe personal changes and
right.
Yeah. Wow. That's pretty interesting.
Yeah. So then you went from that to opening your practice, and we were talking about before, but you see a lot of kids with autism in your practice.
Right.
So, and you wrote a book, The Parent's Guide to Autism. Is that what?
The Parent's Roadmap to Autism.
Parent's Roadmap. And you wrote that with Emily. Is that correct? Okay.
Yes.
Yeah. So what led you to write the book?
Well, it was after being in practice for several years, we're realizing that people just did not have anything to navigate with their healing journey with their child. And there were a lot of parents that reached out to us that could not afford functional medicine. And as you guys know, it's almost near impossible to practice functional medicine on an insurance-based model. And so we just felt compelled to get information into people's hands. And we're like, what if we write a really easy to read book that doesn't take long to read, and people can buy it and they can start to see, oh, I can make diet changes at home. Oh, I can potentially look into gut issues for my child, or I can potentially order these tests on my own, or supplements that might help my child feel better. And so just kind of getting them in the door with biomedical treatment for autism.
So this is really interesting, because I think for a lot of people still, maybe their child starts exhibiting confusing behavior, something atypical. and they go to the doctor and they get a diagnosis of autism. And then that's it. It's like manage the behavior is my understanding, and what I've kind of seen from friends that have kids with various versions of autism. And I think it's what you're saying and what you've experienced and the way that you practice is there's more you can do. Can you talk about that a little bit? Because I think I think that people don't even know that, you know?
Right.
Yeah.
Right. They're
this
not,
episode
yes,
is brought to you by
the
Yin
information
Fang
has not made its
Yin
way
Fang
to
is
ground
a
zero, which is
toothpaste
typically at their
with
pediatrician's
coconut oil,
office.
baking soda, cacao butter, and nanohydroxyapatite. It's non-toxic. There are no preservatives. It has low abrasivity, which preserves your teeth. It supports your oral and gut microbiome, and it's remineralizing. We ditched the tubes to help the planet, and instead, Yin Fang comes in a sustainable zero-waste packaging and delivery system. Get yours at yinandfang.com.
And so, you know, they're seeing signs that their child isn't talking, they're not developing normally, they're probably filling out a survey at the doctor's office. And then, you know, someone is alerted to, well, this child might be on the autism spectrum. Let's get them evaluated by a developmental pediatrician. And, you know, witnessing those behaviors or the lack thereof of speech and whatnot, and then they end up with this diagnosis, right? And they're typically told, well, let's get them in speech therapy, let's get them in ABA, applied behavioral analysis, to train them to react to certain situations, and then potentially occupational therapy or physical therapy. So they're given these tools, right? They're like, here's your toolbox. But what what's not talked about is, well, maybe your child is so behavioral and uncomfortable because they are eating a bunch of food that is causing reactions in their body. Or maybe they're so deficient in iron that they can't sleep. Or, you know, maybe they have chronic infections and that's causing them to be behavioral. So there's a lot that isn't discovered or talked about or tested for. And so what is, you know, and I see this all the time, it's just like, oh, well, they're acting this way because they have autism. But that's just a label for their behaviors. And there can be so much medically going on under that.
Yeah.
Yeah, I'm a different person when I'm just hungry. I mean,
Exactly.
I'm literally, I'm like, don't even come
You're
at me
so
with some of
right.
this, you know, in the morning if I haven't had my like
Or-
smoothie or coffee or whatever.
Yeah. Or kids that can't sleep, you know, they're they strangely start bouncing off the walls and act crazy.
Yeah.
You know, I think we understand it in some situations, although I think still people still may not be connecting the dots in those situations either. But for some reason, there's this, when it gets to some point, then there is a label and then it's just behavior, which doesn't really make sense when you think about it. So would you say that autism in some instances is reversible?
Absolutely. We see it in our practice. We've seen it for years.
Yeah.
And that's not to say that every case is going to turn around and you'll have a fully functioning child that talks. But there's so much that we can do for these children. And even the kiddos in my practice that are not verbal, they're not stimming anymore. They're not hitting themselves anymore. They're sleeping through the night. You know, there's so much progress to be made. The end goal might not be your child will be talking in full sentences and be able to communicate with you verbally, but the end goal might be, I want them to not be in pain and I want them to be able to go out to dinner with you.
Oh, yeah.
And so there's a lot of expectations to manage as well with the new family that comes in with a child who's been given that diagnosis.
This is a pretty broad question, but the phrase like on the spectrum is like just used all over the place. And like maybe just like try to, if you can, like define for me, like what is the spectrum? Like where's the start and stop?
Yeah.
And also as we're talking about this, I think of like so many parents probably have kids and they're like, well, I don't think my kid's autistic, but like they have some like we're saying some little behavioral things and they're all probably scared to like even pursue a diagnosis because they know they're like, they're confident in their functional abilities. So they maybe shy away from getting some treatments because they don't want to get a diagnosis.
Yeah.
Like, yeah, so can we start with like what exactly is
Mm-hmm.
the spectrum and how is that
Right.
determined?
Well, and I think this goes back to like that diagnostic point when they see a developmental pediatrician, because we don't actually diagnose their autism. And that label to me is not necessary.
Yeah.
You know, they often come in with it, which is fine. But I can see that your child's toe walking and stimming or not talking. And those are just symptoms of that label. But the spectrum is really, okay, you can have a child all the way over here that is not talking, that is very behavioral, self-harming, not eating. And then you come all the way over to the other side of the spectrum and you have a child who is fully integrated in school, very verbal, very smart, but maybe they're a little socially awkward and they feel uncomfortable around their peers, or, you know, they get anxious in larger groups. So, and you know, you have some people that might say we're all on the spectrum. We all have a behavior or two that could land us on this spectrum of symptoms. So it's just kind of the severity. What symptoms do you have? How independent are you that they might, you know, place you somewhere on this spectrum? But everybody's in a different spot there. And to your point, the behaviors, I've had patients come in and they've had this diagnosis of autism, and we have, via testing and, you know, just watching their symptoms over time, realized that they actually might have PANDAS. And so a lot of their symptoms are triggered from an infection. And when we manage that infection and we are lowering inflammation and modulating their immune response, they actually don't look like they have autism.
So what's PANDAS, just for anyone?
So PANDAS is an autoimmune disease. It's an acronym. It's Pediatric Autoimmune Neuropsychiatric Disease associated with streptococcal infection. Okay. So that's the lung of it. But
so you're able to basically help treat an infection, and then the symptoms are changed so drastically that it's like, whoa. Yes. I can't even imagine what the parents' type of response is when they go through that journey of like healing.
And there's like a Venn diagram that you can look up, and it has like autism in one and the symptoms of autism, PANDAS in another, and there's so much overlap. There's so much overlap. So that's another piece of the journey, is figuring out how much of the immune system is dysfunctional, and is that playing a role in the way that the child is behaving.
So what's the difference, like at a root cause level? What is, or what have we figured out is kind of like the root of autism versus, you're saying strep is kind of the root of PANDAS? Is that how, am I saying that
and to kind of complicate all of this, right? There's PANDAS, and then there's PANS, which is a similar acronym, but it has everything else involved, like, you know, other infections aside from strep, maybe environmental toxins like mold, Lyme disease. And so there's two acronyms.
Okay.
But what was your question?
My question is kind of, I understand it's kind of PANS and PANDAS is kind of like, but now as I'm saying this, maybe I'm going to answer my own question, but is there something that is tied specifically to the root cause of autism versus then it's like everything else is PANS and PANDAS, like infection, like a pathogen, things like that you can like clear out maybe, or like environmental that you can clear out, versus is there something that's more, I don't know, genetic or permanent with autism, but then if you're saying you can reverse it, then that doesn't make sense. But that was my kind of question.
So what we see clinically, and we see a lot of patterns, right? Because we see a lot of kids. And I think any clinician treating autism would say the same thing, that, you know, you can put together these patterns, and it often looks like potentially a child who wasn't born with a robust microbiome. Maybe they were C-section. Maybe they had a lot of antibiotics at birth. Okay, so that sets the stage. And then often, not always, but often they will have a lot of infections and need antibiotics as a young child, let's say below the age of 1 or 2. And so once again, you're hindering the microbiome, which we know is where a lot of our immune system exists. And so with that, they might be poor detoxers, which we see genetically pretty often in this population, and they have a high affinity for inflammation. So we'll do a lot of methylation testing on these kids, genetic testing, and we will find similar gene patterns. Lots of inflammatory genes, lots of detox issues.
On both populations, or are you saying autism population?
Both.
Okay.
Yeah, both. And so the thought is, of course, there can be genetics involved. There are definitely in those inflammatory detox pathway issues. And for some kiddos, they might even have a chromosomal issue, although I don't see that as often as people want to believe. You know, everybody wants to say autism is genetic. We don't really see that. You know, we run a lot of genetics. And so at some point, you know, it's like an autoimmune disease. These kids kind of hit a breaking point, and the combination of maybe really poor microbiome, lots of antibiotics, whatever they might be eating, environmental toxins coming into the body in various ways, and that just sets them off, and that regression can happen.
So
And
the
that's the same for
methylation,
PANDAS,
the methylation part, is that the inability to methylate as they like process certain, you know, as they,
Right.
Can you explain that a little further, like when you say methylation, because I've like just heard this from other sources, but I want to make sure I
Yes.
understand what you're
So the
saying.
different pathways that involve genetics that can either help you break down your nutrients and assimilate those into the cell, also break down toxins and carry those out of the body. And then there's inflammatory genes that you can have a lot of different inflammatory genes that are easily turned on. And so if you're one of these patients that can't break down methylfolate or can't break down folic acid, can't assimilate B12 into your cells, then that's tied into your detox pathway. So you might not be able to detox.
Is that a chromosomal thing if somebody has the methylation, or is that?
No, you know, there's different ways to look at genetics. And when a child is diagnosed with autism, oftentimes they will have a chromosomal microarray, and you're really looking at the chromosomes to see, is there something missing, added, you know, are there additional chromosomes here and there? And that's a different way of looking at the genes. And when you're looking at the methylation pathways, you're looking at, okay, well, we all have these genes. We all have these genetic pathways. And whatever you were given from mom and dad, does that hinder your ability in this one pathway to do different things, nutrient-wise, detox, etc.? Or is that pathway seemingly pretty normal? And, you know, Ben Lynch, kind of one of the masters of methylation, he's really fun to listen to. You know, he will always say, well, even if you have something like MTHFR, or you have a hindrance in this one pathway, it doesn't mean that you're automatically failing at that pathway. It doesn't automatically mean you're not, you know, you have no folate in your cell or no B12, or, you know, you're riddled with toxins. Like, it all depends also on your lifestyle and how you're living and, you know, your symptoms.
Yeah, thanks for expanding that. That's interesting.
Okay, so I feel like my guess is parents probably recognize some of these things first, or if it's more not minor but less severe, maybe like the school is bringing it to your attention, and there's at some point, right, they get this word.
Okay.
And so how do you help parents kind of move past that? Because I also, like, I think there's so many times when the diagnosis can be crippling, because instead of looking at like, how can maybe we can treat some of these things, and it's like, now you are this, right? Which is really debilitating. So how do you help parents kind of feel empowered again and move past that? And is it through kind of the steps that you talk about in your book? Okay.
Absolutely. I think we see a lot of families who are trying to grasp what they've just been given. They're trying to understand, okay, how did my child get here? And they could be very severe. And so that's a lot to take in. And so we're trying to guide them and say, we're going to hold your hand through this process. Here's what we know we can do. We can uncover so many things about your child. And maybe even, you know, there's no real way to say for sure how they ended up there. I don't know that anybody can pinpoint that exactly because there's so much generationally too that you're bringing to the table with having a child, but it's giving them hope again that this is not all your child is. This label is not who they are. We're going to help you uncover what their body might be needing or missing in order to help them be the healthiest version of what they can be.
Yeah.
So as it relates to like kids or people that have these challenges and symptoms, and you discussed like a microbiome challenge at the beginning of their life, and can you connect the dot between like how like nutrition specifically can maybe impact someone that's had like a, they don't have an ideal microbiome? Like how does nutrition play into that as it relates to people with autism symptoms?
Well, so you made me think of like a lot of the patients that we see, and they have a similar history, lots of antibiotics, lots of infection. And so, we know how broad spectrum antibiotics can kill off a lot of beneficial flora in the gut and leave room for other unwanted flora to take over. So I think about yeast. And we all have yeast in our microbiome. But what we will often see is I have a patient, they've had this similar history and they only want to eat bread and they only want to eat crackers. And they're very addicted to these things because that is what their microbiome is wanting. So it's a catch-22 teaching parents, okay, they're kind of addicted to this because they have probably overgrown organisms in their gut that are wanting that. And so they're feeding it and then they're just making things worse. But also that overgrowth in their gut is causing them to be hyperactive and behavioral and potentially really giggly at the end of the day. And so, doing a stool study and diving into what does their microbiome look like, how can we rebalance this, is so helpful to their behaviors.
So do you find yourself, how do you test for it? Like what type of microbiome testing do you do? And then like, do you kind of like output like almost like a meal plan or work with like a health coach or a nutrition? Like how do y'all how do you understand what the microbiome is? Like in the dental practice, like that's something I'm super interested in because I see these same challenges, but it's like, how do I know what is the microbiome? And then then how do you manage that? Is it with meal plans or how do y'all?
Yeah, so we use a couple different specialty companies like Doctor's Data or GI Map. I know there's so many in the functional space, but we'll ship this little kit to their house and they collect some poop for us. Which
Been there, done that.
Yeah, some people hate it. Some people are okay with it. But then that goes to the lab and the lab is able to put together these results with so many different markers. And we're so blessed to know more about the microbiome in order to know, okay, what species are present, which ones are high, low, do you have parasites or yeast, how are you digesting? So we're able to go through this panel with the parents and point out these different aspects of their child's microbiome and then put together a plan which can include a drastic diet change, okay, we need to limit their carbs and their sugars. We need to get them more vegetables and prebiotic foods, etc. And so we do have a health coach at our practice that will work with the parents and can provide some dietary tips as well, guided by us, some nutrition tips. But that is a really big mountain to climb for a lot of people.
Yeah, we were just talking about that yesterday with all of this stuff is habit changes for yourself is really hard. And then you add the layer of like trying to get your child on board. You have to change like your habit and their habit. So it's like double. So do you have like, I'm curious, just so maybe those that are kind of new to the idea that autism isn't just, something that is forever. And, the way it presents initially, do you have like a cool example of a story of a patient that went from severe to kind of the other way, or anything that stands out and kind of how you got there?
A lot of different patients. A lot of patients that come in when they're 3 to 5 years of age, they've had this diagnosis given to them, and very behavioral, screaming in the office, hitting themselves, hitting the parents, really inconsolable, and just in distress. You see this child, you're like, they are in pain and they're in distress. And then starting to explore the dietary piece. Okay, let's remove this trigger for them. And it could be a food sensitivity trigger too, or an autoimmune reaction to something they're eating even. So, starting with removing those foods and seeing the kid kind of slowly calm down. And then adding some support. Okay, let's give some magnesium, and let's start some like calming Epsom salt baths, and seeing the child sleep a little better so they're less behavioral during the day. And then I think one of the biggest things that over the years that I've discovered is how impactful the environment can be for these kiddos. And meaning, what kinds of products are they exposed to at home? Are the parents burning a bunch of candles? There's just so much input, chemically coming into this child's body that is also triggering a lot for them. So helping these parents navigate cleaning up their environment, and then also ruling out mold in the house. So that's been a big discovery, not a new discovery, but over the years, just realizing the connection there for how severe some of these kids are on the spectrum.
Yeah, I feel like that's so significant coming from you, like someone who is in this space. Like, it sounds like you see that more frequently than you thought you would. To like describe it that way.
It's also like, I can't remember what the statistic is, but it's something in Austin, like there are majority homes that have mold in them,
right?
So it's kind of one of those things where if your child is sensitive, they may, even if it's not covered in black mold everywhere, right? I think there's kind of a misconception where if it's not a ton, then maybe it's not, it can't affect you. But I think especially, certain kids are going to be more sensitive, right? And that's something that, if you just think about statistically, if you live in Austin, right, that's something to look at.
Absolutely. And the toxins from that mold are what affects the child or anyone in the family, really, systemically. And I've had many cases that we have had to move the family out while they were remediating, and the child's symptoms start improving. And it feels like a miracle, but it really is just a product of what their environment was doing to them.
That's, oh my gosh, when we moved out of our house, we did the whole thing, all the testing and all that stuff, because we had water when
we had a pipe burst,
during the big ice storm, a ton of water came in our house. And it was, I learned something fascinating from like the blue collar guys that come into the houses and do the remediation. He's like, well, we live in a 100-year-old house. He's like, actually, and it's up off the ground on pyramid. He's like, these houses breathe really well because they're not so well insulated.
That's right.
So he's like, we barely found any mold, but like, we were, I think, just having it
was there. It wasn't, it could have been, we thought it was going to be, with the amount of water that was, we thought it was going to be everywhere. And he was kind of like, you got lucky because the house was breathing better than we would have thought. So that was, we still had to move out.
So it's not
such a journey,
not a fun thing to do, but also talking about like what it could potentially do to our health, our kids' health, if you just pretend the water didn't come in the walls, which you want to do, right? Like, how does, for maybe people that are listening, like, how would you when you suspect mold in the house? Like, so what's the protocol? Do you have like a company that you go to, and how do they test for it?
There's a couple of companies that I like, and they both do different things, which is interesting. Toolman Mold Inspectors here in Austin, they're phenomenal. We've had them test our house, and they do a combination of swabbing certain areas, sampling certain areas, air testing, thermal testing to see where the moisture is high. Of course, they'll look at every square inch of your house for just visible details of any issues. So that's been really amazing for a lot of our patients. And then kind of newer on the new front is the mold dog.
Oh, okay.
Have I talked to you about this?
No.
So there was a guy in Florida who was flying to Texas pretty regularly with his trained mold dog. They trained this dog to sniff out mycotoxins. And he was flying here so regularly that he ended up training, I don't even know, maybe 2 or 3 other dogs in Texas.
Wow.
And so now we have our very own Texas mold dogs.
Nice.
And this is just incredible because they will come through your home and they're so sensitive. Their noses are so sensitive, but they will detect it wherever it is at, behind a wall, in your furniture, in your car. And so we had, a personal mold experience where there was evidence that there had been a leak with the prior owners, but none of the testing we did really gave us information that there was mycotoxins there. And then we had the dog come behind, and sure enough, he smelled it, and it was like we had to tear the wall apart, but it was there.
Yeah.
So just direct confirmation from this dog, and they don't lie.
Yeah.
So
that's amazing.
That's really cool. That
so
seems
neat.
That seems like the way to go.
We had conflicting assessments, but I don't know if one of them was like from the insurance company that's like, oh, there's nothing here, and like contractors like, I see mold on the wall, like visibly. How can you say there's no mold? All this water just came in, and the guy's like doing some testing. So then I think we paid for ourselves. We said we'll bring in. You may even give us the record. Someone. We got a second recommendation, and he was like, "Oh yeah, no, this like test positive." Like,
oh gosh,
I love the dog.
That's really cool.
Taylor Barnes. I'll throw out her name.
Okay.
She's pretty incredible, and I will just say that has been life changing for so many people because, I talked about PANDAS and PANS. We see a lot of PANDAS and PANS, and I can't tell you how many kids we have said, "Listen, get the dog out or get Toolman out," and they have done the assessment, found mold, get that child out of the house, and their behaviors just calm down.
Yeah.
So they're not being constantly triggered.
Yeah. We saw that in our own kids, which...
That's true. I feel like we definitely saw a positive behavioral shift when we got out for that time period.
And I mean, you hear stories separately from like autism and PANS and PANDAS.
Right.
Like there's stories of like couples that get divorced because they don't realize that they're depressed because they're living in a house with toxic mold. I mean, it's a thing. Yeah, it's a real thing. So I love the dog. What a good tip. That's so
know.
Cool that someone is, and it sounds like it's more, I would believe that more.
Yeah, 100%.
I always like a lab test. I'm like, are you tricking me?
I know. I know. And I've heard stories from the dog kind of going into new builds, which everybody wants to believe new builds are fine. But like you mentioned, they're built differently. They're very heavily insulated. And I've seen, and you've seen, I mean, when they're building a house and they frame it and then it rains for 3 days and then they come in the next day and they put those walls in real quick and then you have mold growing. So I've had patients that were in new build areas and their entire house has mold behind the walls.
Yeah.
And they just have to take that house down.
Yeah.
Yeah. You mentioned Emily as like, I think it sounds like you have another practitioner that you probably lean on each other a ton. And like at any person, like I also have like a doctor friend in North Carolina, Trey Maynard, and we still stay in touch and like bounce all our ideas off of us. But I remember he redid his house. And I think at the end of the remodel, water got in somehow through the HVAC or some type of thing. It was like brand new remodel, but like mold got everywhere. So then they had to move back out again. It was like, the new build thing is it's really real tricky thing to navigate.
Yeah.
It could be a stressful thing.
It's a pain.
I know.
And dealing with.
I mean, I feel like the neat part of a lot of functional medicine providers is they have been where their patients are.
Yeah.
Not in every aspect, but I mentioned I grew up in black mold, and when I was an adult and talking to my dad, I started talking to my dad one day and telling him about all of these sick patients that I'm seeing that I've discovered are living in mold and they're very symptomatic, and he just we're at the dinner table. He's like, oh yeah, we had black mold when you were in middle school. And I'm like, what? Dad, like, you mean when I had severe OCD and anxiety? And he's like, oh yeah, that's probably around the same time. I'm like, oh my gosh,
Yes.
putting the pieces together. And so it is always just humbling to see someone else walk through that journey and know, like, I've been there. I've been there. I mean, my kids have been through a lot of different health things, so I can relate to a lot of my patients.
Yeah. Okay. So last question before we move off of autism, because I want to get into some other stuff, but what is one thing that you think that you would like parents of children with autism to know, like something that would kind of change their world if they knew it?
Oh, I feel like just telling them that they are not restricted to therapies. There's so much more they can do for their child. Mm-hmm. There's more to explore. So continuing to look for answers as to why is my child behaving this way? Why is my child reacting this way to things, and not being so limited by ABA and speech therapies.
Yeah. Cool. That's great. I think that's so important, because often there is just like, one provider that whatever your pediatrician says kind of goes. So, and that's like the end for a lot of people. So I think that's so important.
One thing else I want to mention is, within our functional community, we're pretty close and everybody knows each other and we're all very supportive. And we also know, like, outside of that, who's supportive of what we're doing and who's not. But what's been really remarkable, there is a developmental pediatrician who was at Dell for the longest time, a very good friend of mine and Emily's, and just kind of inched her way into learning more about functional medicine and was able to recommend, okay, let's put your child on some omegas or some zinc and magnesium, and kind of see the connection between them getting improvements. And she's opening her own practice. And so she diagnoses and does all the diagnostic piece of it, and is able to, if they want and need that label, but also just opening herself up to the possibility of other testing and whatnot.
That's how it all starts, right?
I know.
And then another one of her colleagues will be like, hey, what are you doing different? And
exactly.
Then it can grow, and it's ultimately all about helping the patients have more tools.
Right.
Yeah, that's an awesome story.
Yeah.
That's encouraging to hear, like, that you see it, like, as more of a supportive community.
Right.
How about, like, kind of now going more like general, just generally, like, people probably come to you for health advice about not just autistic, I'm worried my kid has autism, but like just generally like foundational health, like if you have a kid, a baby, a toddler, or a young kid, like what, like some maybe core recommendations to have a good foundation for health. Like, do you have some recommendations you can share?
Oh, there's so many. I feel like nutrition, there's always so much. There's so much to think about.
Where do I start? Like some big ones.
Okay. I think nutrition is so key to everything. And I tell patients this all the time. My patients who are eating the best, the most whole food, low inflammatory diet, are the ones that are healing and the ones that are doing the best. And I know that's not always easy, but I think what's key to that too is starting them off that way and not getting on this slippery slope of junk food, fast food, sugars, because there's so many patients that I see and they are old enough to, go get their own food and pick out what they want to eat. And they've been eating that way for so long that it is very hard to change it. Yeah. So, for new parents, starting your kids off on whole foods and not deviating based on society, I think that's really hard for everybody. Yeah. But I'm living it. I'm living it with my boys. And, you have to be able to stand by what you believe in and say, no, we're not going to do that. We're not going to eat that. And, I know what that slippery slope looks like.
Yeah.
Yeah. I'm always surprised. I think most parents this resonates, right? You're always surprised how smart your kids are too.
Yes.
Like, and how much they retain. Like our neighbor was telling us, our 5-year-old was at his house, And he was like, do you want a snack? And he was like, well, it depends. Is it gluten-free? Is it? And he was like, whoa, does it have dairy in it? What kind of dairy is it?
Uh-huh.
You know, and he's 5.
Uh-huh.
I was so proud to know that, like, you know,
He's
just,
asking
like, not
questions.
just like, no, you can't have this. It's more of like a conversation of like,
Right.
let's talk about it. Like,
Yeah.
you know,
Yeah, and also to be realistic, if they were like,
Mhm.
we have a chocolate bar, he'd be like, I'll take it, whatever it
Yeah,
is,
yeah.
you know?
Don't tell my parents.
Right, sure. He's still
Right.
a 5-year-old child. But
Exactly.
yeah, I think there is like having those conversations and setting the example at home. It's not about being perfect.
No,
Right?
'Cause
no.
then they eventually get, you know, some snack that makes you cringe. You know, like someone hands
Sure.
it to them, and you're like, oh,
Yeah.
I'm not gonna like.
Make
Okay,
a
fine.
scene.
Yeah, we're not gonna make a
Mhm.
scene here.
Yep.
And then they like start acting absolutely crazy 30
Uh-huh.
minutes later, and they melt down, and you can kind of be like, hey, yeah, remember how we talked about these things? And,
Yeah.
and
Yeah.
they will connect the dots, like the
Mhm.
kids.
Mm-hmm.
So, okay, yeah. So
What-
go ahead.
I was going to say, what about, I feel like there's a lot of, well, for me, I understand I've been doing this for myself for so long, but like, I think gluten-free and dairy-free, it's been having a long moment, you know? And I think like, and like the positive is, in the food world, we've come a long way from like
Mhm.
15 years ago when that was just like a thing you did and there weren't any other like alternatives on the shelves.
Right.
Now there's lots of alternatives, but I think it's also made the purpose behind it confusing. And what does it really mean? Do we need to be doing that? What is your opinion? I think because a lot of adults can do it on, you know, can try for themselves and say like, okay, I feel better gluten-free, so I'm going to be gluten-free. I think there's like confusion and maybe fear around taking things away from kids.
Mhm.
So can you explain a little bit about, you know, when the right time to try those things would be, what the benefit is, like, is it okay? Or are you like, you know, is it not okay when they're developing? Can you talk about that a little bit?
Yeah. So from an allergenic standpoint, the pendulum has really swung, you know. I mean, I think back when I was in nursing school, it was like, don't give kids peanuts and eggs. And, you know, it was very like, don't do it. And now it's swung the complete opposite direction. And we have these like, you know, baby foods that have all of these allergens in them to try and, you know, get the immune system used to that so that it doesn't have such a big reaction. And we maybe can prevent some of these allergens from happening. It's almost like a little bit of immunotherapy. But, you know, I feel like if you weave in some of that here and there, but it's not your everyday foods, that it can be given in a healthy aspect. And so, you know, whether it be some dairy or whether it be some good sourdough bread that has a little bit of gluten in it, that can be a healthy part of their diet. And if your child is not reacting to those foods, then they can have a healthy relationship with all kinds of foods, right? And they can have, you know, peanut butter and a cupcake here and there. But in my population that I'm seeing, a lot of these kids are reacting to those foods. And so it is a matter of needing to remove that food, whatever it might be, for a time period or maybe indefinitely if they're incredibly reactive. But just generally speaking, the population, I think when you go to restaurants, when you go to the grocery store and you look at ingredients, it is extremely hard to avoid all of that. And so what that tells me is our diet is incredibly inflammatory. And when you are practicing, you know, dairy and gluten-free lifestyle, you realize that. Because you go to places and you look at the kids menu and it's nothing but gluten and dairy and seed oils. And you know, so and we know America is vastly unhealthy. And so it's like, well, I don't know that we're doing things right here. And even though it's common and it doesn't mean it's good.
Right.
So it's a fine line between, like you said, creating food disorders or eating disorders with a child and having to remove certain things because of medical circumstances versus teaching your kids that this is how we eat in our household. And these are going to be sometimes foods and these are going to be everyday foods. And we have done that with our kids specifically. And, you know, they have some intolerances that we have to be aware of that they don't get to eat, like gluten. But if we're at a birthday party and they want a gluten-free cupcake, okay, that's a sometimes food. And we try to avoid dyes. And so there's some rules within our home.
Mm-hmm.
And I think it's just creating those healthy eating habits and teaching them, well, okay, if you eat this or if you drink this, I want you to see how your body feels. And I can see it, but I want you to tell me how your body feels. And I think that that's really important for them to learn too.
Yeah, like fine-tuning that antenna, that intuition, listening to your body.
Yeah, like my littlest one, who's now 8, he, he's had that experience going to friends, had a snack, binged on something, when we weren't there, fine, come home, I have the worst stomach ache. I'm like, well, what did you eat? And, he'll confess whatever. I'm like, okay, well, this is a great opportunity to talk about how we chose this, our body didn't love how much of that we ate. So next time we need to be mindful of the quantity or what it was that we chose.
Yeah. What about I think that stomach issues are more obvious for people when they're like, okay, I ate this, I don't feel good. But I find that there's more, there's not as much understanding about okay, but also you can be eating gluten or dairy and it could be tied to this other symptom. So just because you're not having a stomach ache doesn't mean that you're not intolerant to it.
Correct.
So what are some things that you look for to see if there might be an intolerance?
Well, we do testing in our clinic. We'll do a food sensitivity panel. We'll run, celiac panels, food allergy panels. And so that's, lab testing. You can look at that and see there's a reaction happening, which I think can validate that for a lot of people. And, I like having that, especially for kids when you're saying, hey, your body doesn't love the milk you're drinking every day, and look at this lab value. This is showing me that your body is rejecting that and they're, producing antibodies towards it.
Yeah.
However, there are some kids that, they'll do an elimination diet and say, I just know I feel better off of this food. And so we might not need to validate that. They just know they're going to do better off of it. But yeah, we use a lot of lab testing to validate that. And what I will say, it has been, and I tell people this all the time, I can't tell you how many kids have come into my office, and we usually throw a celiac panel on blood work if they're eating gluten, and they have not had GI symptoms and they have had a positive celiac panel, and they remove gluten and the behaviors get better and the symptoms get better.
Yeah.
And so it's important to remember that just because it's going down into your gut doesn't necessarily mean you're going to have gut symptoms from that food, but it could be that when it's there, it's creating some level of inflammation, proteins are leaking outside of the gut lining into the bloodstream, and your immune system is reacting to that. And so whether that be eczema or headaches or, not sleeping or, joint pain, there can be systemic signs that your body is reacting to something.
Yeah, and left unchecked, it might rear its head in your 20s or something like that, right? And we were saying, and now it's progressed a long way. There might be much smaller symptoms that you're describing.
Yes.
I want to circle back to one thing you mentioned, because we have talked about this a bunch with our family history, but C-sections, how that affects the microbiome, and they're really common.
Yep.
The procedure is really common.
Yep.
So maybe it's maybe kind of redundant with what we've talked about, but let's just say someone had a C-section with a child. What's a good protocol to maybe consider, assuming that their microbiome is different because they didn't travel through the canal or I don't know. Will you describe how that happens and maybe some treatment strategies or things to think about?
Sure. I know. And when you ask me kind of what you would recommend as a blanket recommendation or what could be something people focus on, a lot of things are out of our control, right? So we might have this vision that I'm going to have my baby naturally and they're going to get all of what they need traveling through the birth canal, and then it just doesn't end up that way. And so if we end up having a C-section, they're exposed to a sterile hospital environment. And I've heard some very bright clinicians speak about this that do functional OB gyno work, and they will go and they will, swab mom's vaginal canal, and they will swab baby's ears and swab baby's mouth with it, and, kind of put it in all the orifices because that's what would have happened.
Yeah.
And so that baby can still get inoculated with the healthy microbiome of mom, if you can like convince your OB to do that. So it sounds very weird, but that's what is recommended. And hopefully that practice will catch on, and then you'll have babies with healthier microbiomes from the get-go. But then, of course, you can introduce probiotics fairly early, breast milk.
That's such a huge tip to like, if somebody is like not had kids yet, or they're going to have a kid, is to like have that conversation with your whoever is going to be delivering your kid. If you end up in the hospital and it ends up in a C-section, can we consider this? Because I can speak from firsthand knowledge. Like our oldest C-section, he has a different oral microbiome. I mean, I look at his mouth all the time.
Wow.
His tonsils, his breath, his mouth, the way he puts tartar on his teeth, it's totally different. And it's like been like something that, which affects his sleep. I mean, it's all so interrelated.
Yeah.
And I think that's like something, if I could like turn back the clock before we ever had a kid, like if this scenario does happen, like what's our plan? Because like I want to try to mitigate these challenges that might come from it. That's really cool.
Okay, what about I'm curious what if this comes up with patients, because I feel like it's everywhere right now. But what about like vaccines and the role that they play? The role that they play or don't play in and it doesn't have to be like specifically to autism, but like just kind of adding to the body, or is it helping or hurting? Is it dependent on the person? What is is this something that you talk about with patients, or do you avoid?
We talk about it with patients. I would say it's obviously a very hot topic, and we have to be very careful. I mean, the bottom line is that we are trained through an institution, and we have our license through that same institution, and we have to kind of follow those guidelines, or we can get in trouble for that. And so, what I tell parents is it's ultimately their responsibility to be educated on what they're putting in their child, and that whether that be food or vaccinations, you have to know the risks, you have to know the benefits, you have to do your homework, or be able to talk to your provider about it and say, hey, I want to know, if I choose to do this, what are the benefits and risks for my child, or can I see the package insert? And really, as a mom and dad, you have to feel comfortable with what you're deciding, okay? Because that looks different for everyone. And if you have a strong history of autoimmune disease in your family and you're nervous about that standard schedule, then, I want parents to feel comfortable talking to their provider about delaying or having an alternate schedule for their child. Because like you mentioned, just as not every antibiotic is going to be good for every patient, you have a child who's going to react to that amoxicillin and have a rash, and then you note in their chart, I'm never giving them amoxicillin again. There are children that are not going to be able to withstand 5 vaccinations at one time. Okay. And someone might disagree with me on that, but that we see it all the time. People have reactions to everything, So, I mean, while there is benefit, there is also risk, as there is with everything. And so I just empower my parents to feel comfortable with what they're deciding to do for their child. And whatever they decide comes with those benefits and those risks, right? On either side of the coin.
Yeah, I feel like my like commentary on this is like that the informed consent part is like, I got ditched a long time ago. I don't know why. And like, I have people, I do a procedure, right, where I'm like taking out everyone's teeth. Yeah. And it's like a major, like, physical, emotional commitment to sign up for these things, but not how someone will watch something like a marketing thing. They're like, I want my teeth out. I want my perfect teeth in a day or whatever.
Oh, gosh.
And I'm like, okay, for maybe the patient that came in at 9 to ask about it, they really need it. It's the perfect thing for them.
Right.
But then the person at 10 is like, no, this would actually, the same procedure is bad for you, but good for you.
Exactly.
And, but like, just, so like taking time to talk about informed consent, I'm just like interjecting my personal opinion about this. I feel like when it comes to the vaccination thing, there is no informed consent. It's kind of pressure.
It's pressure.
And I would say like, even like rolling circumcision, like, you know, being a parent, you know, there's a lot of these pressure things, a lot's happening.
Yeah.
It's, you know, it's just like you haven't slept, like, oh my God. And then like you're trying to keep pace with all these decisions.
And it's hard being a parent. And I think there's just, like you said, there's so much pressure. There's so much fear. There's a lot of emotion around it too. And, you know, you hear one story from one parent, and then you hear another from another, 2 different circumstances. And so there's a lot of, fear
Is
around
there like
it
a
too.
really good book or resource that you point people to get informed about?
I have really loved Paul Thomas's book, The Vaccine Friendly Plan. I think he has amazing worldly experience, and he's a physician, and he has written about each of the vaccinations in detail. So it's a good one to kind of wrap your mind around, okay, what is this even for? Because I feel like that's another thing that, you know, I might have learned in school, but you have these 15-minute pockets with this family for their well child check, and you definitely don't have time to talk about each of those in detail.
Right.
You don't.
Absolutely
you just
not.
absolutely don't. And so unfortunately, you know, the parents have to come in kind of knowing that and doing their research and feeling good about it. And
yeah, we'll link the mold dog and the book in the digital show comments. And
and I just brought it up not to be controversial, although I'm sure it is.
Super controversial.
But it's but it's like but I think it's like if we don't talk about it, then you can't form an opinion about it. And and we're talking about the whole purpose of talking about all of this stuff is that you may have an idea about it's a label of something, say autism or some chronic disorder. And now you realize, oh, well, actually the body's having trouble detoxing, or you need this nutrient, or you have mold in your house, or your cleaning products are poisoning you. And, you know, those are all just points of things that are going in or coming out of your body. And this is just another thing that goes in, right? So it's like, I feel like, just like dairy isn't good for me, you know, but it might be good for you. I think there's a world that we have to like get to where it might be good for you, it might not be good for you, you know. So and for really sensitive kids, which from my perspective, kids that are autistic or on that spectrum are having severe symptoms, severe like neurological behavioral symptoms, they may be more sensitive to whatever it is, right? The food, the air quality, whatever. So I think it's just something to, it's not painting anything as all good or all bad. It's just that we have to be able to like ask the question and think rationally through like, well, what is this thing? And is this going to be helpful in this situation or not?
There were 2 things that I thought of during that. So one is that, you know, we kind of touched on the methylation panels, and there's a couple of companies that we love using. One is now called Fagron Genomics. They used to be GX Sciences. And then the other is Intellex DNA. And they're both local companies, physician-based, amazing companies with a lot of research behind the genetic pathways that they look at. But what I think is really neat and what we should do more of is babies born and you run like this foundational panel on them, and it gives you an idea of that folate pathway, their detox pathway, their inflammatory pathway, and kind of looking at their genetics in a whole and seeing, oh wow, like this baby is going to be have very hard time detoxing and lots of inflammatory genes. And so maybe I would recommend, you know, kind of a delayed alternative schedule. And this baby has like no inflammatory genes, so great detox pathways. I think they're going to be great on the standard protocol. And so I wish we could I wish that was more acceptable and standard.
I wonder if this is what they're doing something now for animals. Vets are doing, it's called titer testing.
Oh, I have a whole story about this.
Do you?
Oh my gosh.
People
are going to think I'm nuts.
We just got a puppy. We just got a puppy, and I searched all over Austin to try to find a vet that would do this because I'm curious about it.
Okay. Well, we have a dog, and he's 6'6" now. He's 7 pounds. Okay. Tiny, like newborn. Yeah. And I went in for our visit with our vet last year, and, he's due for, 4 vaccines. And so I'm just like trying to talk to, he also has seizures. Okay. So there's that. And I said, I was talking to our vet. I said, hey, the neurologist that we saw for our dog was wondering if he could potentially be having a reaction to one of these vaccines. And so I had a couple questions for you. A, do you give the same dose of rabies to my 7-pound dog that you give to a 100-pound lab? And he said, yes, we do.
Wow.
And I said, oh gosh, that really makes me feel bad about this because I'm thinking that's a big dose for this tiny dog and probably a normal dose for this big dog. Yeah. And I said, well, will you entertain something for me and just run these vaccine titers on my dog because he's having seizures and I would just want to make the best decision for him right now. And sure enough, he ran all the titers for me. It's not cheap. And he was protected against everything. Everything. He did not need this boosters.
He was already protected. His immune system.
He was already protected from the previous ones that he got. And so it just had me wondering, I know in the vet world is, very far behind. They're not doing titers on animals, they're probably not doing a lot of it, but he was open to it and he was able to have that conversation with me. And it just made me think about, of course, here we are in humans, but this is a dog. But anyways, kind of making a point.
Yeah, that's so interesting. Yeah, well, there is a vet in Austin that does it way down south, but we're going to take the new puppy to him. And I don't know a ton about it, but the idea of checking first makes sense to me.
Right. And, in our practice, we have had patients that were due for those 4-year boosters, which they've all had them, right? It would just be a booster. And the parents have kindly asked, hey, can you check their titers? Could this be something that we delay a year? And I know that's not the recommendation, but we'll say, okay, let's check the titers because if you are protected and you have those antibodies, then you're protected.
Yeah. Right.
And it's on a lab. You have X amount of antibodies, you are protected. So I don't know why we don't do more of that.
Yeah, interesting. That's so interesting.
Yeah, and I think the world's baseline knowledge has come up a lot in the last 4 or 5 years on that common sense thing of am I protected or not? Am I making antibodies? Right. Now everyone most adults can follow this conversation now.
Yeah.
Maybe we couldn't.
That's true.
Yeah.
Okay. We're, I could talk about everything for hours.
I know.
For hours. Let's try to wrap it up here. Okay. What about some supplements? I feel like this is a big, overwhelming space for parents and for individuals just in general, but for parents, are there things that you think are great across the board to be giving to littles or that you recommend everyone should be taking? It's just kind of basic gut and immune health.
Well, I'll tell you what I see most often on labs because we do a lot of lab work and the majority of kids are very low in vitamin D. They're low in zinc. They're low in iron. Not all of them, but a lot of them. And then a lot of them are struggling with their B vitamins. And so I really encourage parents to ask for their kids to have their labs done. I think it's just really great information to have. And maybe it's not something you do every year, but maybe every 2 to 3 years you get a lab panel done because it can really make all the difference in the world. With how they're sleeping and how they're eating and their inflammatory risk. And that way you also know, okay, this child absolutely needs vitamin D and you're not blindly supplementing because that can be worrisome as well. So that's step one, is try to have a baseline on your child. If your doctor will order that for you, I think it's really important. And then, depends on the child. I think a lot of kids could benefit from a good multivitamin. Not all of them are eating a variety of colorful foods, and so they're
What's your favorite multi?
I have a couple. I like Integrative. That's a liquid one, and it's pretty robust with just a little bit of everything. It's a good, robust vitamin. That one's a good option. I do have kids on Smarty Pants. I mean, it has methylfolate and B12. It has a little bit of omegas. It's not my favorite because it's a gummy, but if you have a kiddo and it's like they will only take a gummy, well, okay. Yeah. Here we are. I like Hiya, Hiya. That one's great. It's a tablet. It's a little bit harder to chew, but it's very well made. No sugar, very minimal.
Like that one, right?
Yeah, we have that one.
Yeah,
I like Hiya. If your kids can swallow, there's a good Junior Nutrients by Pure Encapsulations. It's a very good, kind of broad spectrum multi for a little bit older kids. Trying to think of any of the other ones I like. Mary Ruth.
Oh, yeah.
She's real popular. I like her stuff.
Yeah.
She's great. Lots of liquid options. And then omegas. I think most kiddos need omegas. Unless they're eating salmon and fish on a regular basis or chia, then they're likely pretty deficient in omegas. And so that's one of the first things I usually put patients on, especially my ADHD kids, my hyperactive kids. My kids with a lot of inflammation, they're going to get a high dose omega. Cod liver oil is wonderful because you have that added, or not added, but natural vitamin A. So you have the antiviral protection, good dose of omegas with that. I give my kids pretty periodically D-hist.
Oh, yeah.
I mean, we're in like an allergy mecca here. And so they don't struggle heavily with it, but if I see that they're sneezing and they're sniffling, I'll give them a D-hist. It has quercetin in it, which is an amazing bioflavonoid. And so lowers inflammation, helps lower histamine levels. And then we do a lot of magnesium and L-theanine in my house. And so we'll do Epsom salt baths for the magnesium. We'll do topical magnesium from Ancient Minerals. I love their lotions. And then I'll do like an oral L-theanine liquid. If my kids are like struggling to go to sleep or they've had a really busy day and their minds are just not turning off, we'll do L-theanine. I'm trying to think of what else I throw at them.
I think your cabinet dispensary looks a lot like ours.
It is, and I'm not very like, oh, every day you're getting X, Y, Z, but I'm kind of like, okay, how are you feeling? What's going on here? I'm going to like pick and choose what I give you. We might do some like full moon parasite stuff,
Yeah.
I'm trying to think of anything.
Oh,
else.
that is such a good, this is a selfish question. This is a selfish question. What is your go-to parasite cleanse? Like, are you regular? Because I do like a regular, or I shouldn't say regular. I've done cleanses the last few years.
Yeah.
And I also just was reading something that's like, if you have an animal, then you have parasites guaranteed. And I was like, yes. And our dog recently had something. So I want to get everybody through that. Like, what is but again, it's like, I know how to do it for me, but I get nervous about
kiddos
and detoxing it and all of that.
I think it's so funny. And I talk to parents about this because a lot of people will tell you, and I recently had a GI doctor tell me, oh, people don't have parasites in America.
What?
I only test for
what
parasites.
About pinworms?
Oh my gosh.
I mean, I've seen it with my own eyes.
She's like, oh, I only test for parasites if someone has come back from overseas. And I'm like, well, we give our dog like a parasite medication every month.
Yeah.
So certainly something is going on here, But anyways, so, the dog gets their, I looked at the parasite med. It's like ivermectin with pyrantel. Pyrantel's the pinworm med. Ivermectin, everybody knows about that. And they get that combination on a monthly basis if you're giving them the meds that your vet is giving you. And so I do think it's important to think about this. There's other countries that will do deworming once to twice a year on their children. And so, a couple times a year, I I like BioRaise Happy.
Mm-hmm.
It's liquid. It's very gentle. Has a lot of good herbs for parasites. Paragard is another really great liquid that is just comprehensive herbal treatment, and it has dosing for children and adults. Cellcore has a really wonderful line for anyone who could swallow pills.
Yeah, that's
Probably
the one that we've
older
done.
kids. Yeah,
And
yeah.
Our kids can all swallow pills.
Oh, okay.
thankfully.
Yeah, so that's great. One of their products, I think it's Para 1 or 2, has Mimosa pudica in it,
Mm-hmm.
and that's amazing for like recurrent pinworms.
Mm-hmm.
So that's a good one to have on hand. But I'll use the BioRay or Paragard, and sometimes I'll throw a little ivermectin in there. I know that I have access to a lot of the pharmaceuticals, so I can do that too. But I think it's been pretty helpful for my kiddos.
Do you do like a binder when you do that? Do you have to be careful about that, or you can just dose the
the BioRay has some chlorella in it, which can act as a binder. So I feel like that one's gentle enough that you can go without too much binding. Cellcore, yes, you got to have a binder on board, whether it's like activated charcoal or chlorella or clay or pectin.
Yeah.
Some of the heavier duty ones, you want to have a binder on board with that.
And the reason for the binder is for someone that maybe doesn't follow this.
Well, when you're killing things off, I mean, whether it be yeast or parasites, they can release endotoxins. And so that can make you feel terrible. I mean, you can feel like you have the flu, your child can become more behavioral. There's just a lot of releasing toxins that is going on. And so the binder can kind of soak that up and help you get rid of it.
Got it. That's helpful. Yeah, there's a whole nother rabbit hole for parents to go down. Is like when your kid starts acting crazy all of a sudden, it's like
and around the full moon, it's real.
Yeah, it is so real.
Yeah.
Something I never thought I would
believe
think about in my life. It was like, no, it's one of the things. It's a real thing. Oh
I know.
God, no wonder they're acting crazy.
Well, and you talk to people that work in the ER, and they will tell you that the full moon brings in just the weirdest stuff.
Yeah.
And it makes sense. Like maybe all of these people need a parasite cleanse.
Yes.
Yeah.
Right?
Oh, parasite cleanse. Well, last night was like the blood moon. So
right.
Everybody needs to get on it.
Exactly.
Okay. Well, we're going to have you back because I have like 1,000 more questions. Or maybe I'm just going to have to bring the boys in and just like pay for your time. But thank you so much for being here. Tell everybody where they can find you if you want to plug anything, if you have anything.
Okay. Yep. So I have a page on Instagram that I infrequently post on, but Healthy Texas Home. And then we have our Neuro Nutrition site, so they can find us on Instagram. And then, our practice is here in Austin, if anybody wants to come see us there.
Yes, highly recommend.
Yeah, we can personally vouch for it.
Yes,
and your care.
Our kids have had various things, and you've been so helpful, and also just such a good listener and kind. And so anyone in Austin that's looking for a good pediatric practitioner.
Thank you.
Yeah, so thanks again for being here, and for sure we're going to schedule the next one because I want to keep talking.
Thank you guys so much.
Okay.
Thank you.
Thanks.